Hi, I'm Dr. Ron Miller with Pursuit Physiotherapy, and today we're going to go over how do you treat piriformis syndrome. Okay, now first off, what is piriformis syndrome? Your piriformis muscle is one of your deep external rotators in the glute region. It's underneath your glute max, and a lot of times you can point right here's my pain. It's right over the piriformis muscle, and when I touch the piriformis, it goes into spasm and it's really painful. It's an easy diagnosis to make. But the main point of today's video is what is causing the piriformis syndrome. Okay, your piriformis, which is an external rotator of the hip, doesn't just go into spasm. Okay, piriformis syndrome is the effect. It's not the cause. Okay, and when you're seeking treatment for your care regarding a piriformis syndrome, you have to address the causes of it, not just the effect, because otherwise you're just going to do some myofascial releases, you're going to do some massages, it's going to feel better short term, but then your symptoms are going to come right back whenever you sit or drive, or whenever you try to go back to sport or running, your symptoms will always come back. So the piriformis syndrome is actually the effect. It's not the cause. Many times you have either some sort of low back problem, you have an SI joint imbalance, or you're literally lacking some hip flexibility that is causing the actual piriformis syndrome. Recently we've seen this complex case where this guy had left glute pain, which was diagnosed as piriformis syndrome for years, and no matter all the injections, all the pre-op surgeries, all the imaging, all the failed treatments, he kept having this piriformis syndrome. And he was almost fed up to a point because he couldn't cycle anymore, he couldn't do anything. And he was actually going to get surgery and say just go in there and release the piriformis syndrome. Not until I did a thorough eval and assessed his hip range of motion, his pelvic alignment, corrected that, is when he got a full resolution of his piriformis syndrome. And now he's back cycling, he's mountain biking, and he really doesn't even notice his glute pain anymore. So this is a perfect case of just to highlight, if you're struggling with piriformis syndrome or you think you have piriformis syndrome, stop treating the piriformis, but start treating the impairments that are present, thus causing the piriformis to go into spasm. So I hope you enjoyed this video. If you're dealing with piriformis syndrome that failed multiple treatments, or you have more questions for us about our treatment approach here at Pursuit Physiotherapy, give us a call today at 407-494-8835, or you can visit the website at pursuittherapy.com. We have plenty of information about our treatment approach, piriformis syndrome, and some of the results that we're having. So thank you for checking out our video, and I look forward to your phone call. Thanks.